welcome to Dr. America. I am your host, Dr. Sanjeev Sriram. And my fellow Americans, I'm here to give you the state of our union's health. And, well, the state of our union's health it's all right. There's, a lot that we have done in the last several years that I think has really improved our nation's health. There are things that are in the works right now that show a lot of promise for progress. But there are a lot of areas where we need to get together and get some serious work done so all of us can live healthier, fuller lives and not have our health be something of an obstacle for pursuing that great American dream, whatever your American dream is. So today's episode, we're going to cover a couple of areas that are really important for the State of the Union's health. And our first area that we really need to talk about is expanding Medicaid for so many communities of color across the country. I see Medicaid expansion as a civil rights issue. It is the civil rights issue of our time. It is related to many civil rights issues that are going on right now connected to police reform, criminal justice reform, raising the minimum wage, and we're going to, you know that the show we get into a lot of those issues. But for right now, let's talk about expanding Medicaid and what exactly does that mean for our country's health and especially for the health of our fellow Americans living in communities of color. So to guide us through this conversation, I'm really excited to bring back Dr. Yolanda Hancock. Some of you remember her from the second episode of Dr. America back in November. Just to remind you, she is a pediatrician practicing here in Washington, D.C., and she is also the founder of Delta Health and Wellness Consulting. She did her undergrad and got her MD both at UCLA, and she is currently an assistant professor of public health at the George Washington University School of Public Health. Welcome back to the show, Dr. Hancock.
Thank you so much, Dr. Sriram. Thanks for having me.
All right. So, as you know, the Affordable Care Act went into effect back in 2010, and the option for states to expand Medicaid started in 2013. And right now, at the time of this State of the Union's health address, we have 28 states expanding Medicaid. What would you say has been the impact of Obamacare and states choosing to expand Medicaid on minority health?
So, here's what Obamacare has meant to minority health. When we look at the rate of uninsured African Americans prior to implementation of the Affordable Care Act, it was around 25%, and now that it's been implemented, it's gone down to around 16% nationwide. And we look at uninsured Latinos, it's been cut in half from about 33% to 16.5%. And much of their coverage comes from the 26 states that have expanded Medicaid. Okay. And, but it does sound that, we're looking at a geography issue here. And it's sort of like a geography issue, but it's also kind of an income issue because, a lot of these communities of color were uninsured before the Affordable Care Act, largely because they're disproportionately low income, right? You're absolutely correct. When we look at the rates of poor among people of color, 59% of African Americans and 51% of Hispanic Americans have incomes below or at 138% of the federal poverty level. And when we're looking at that, I remember when I was in the School of Public Health at Hopkins, I really didn't understand what that meant until you put a number value to it.
Mm-hmm.
That's about $27,000 a year for a family of three.
Wow.
For comparison, you're talking about 40% of whites living at that same level. So over half of African Americans are making $27,000 a year for a family of three. And many of these families are actually working at jobs that don't offer health insurance, or those jobs don't pay enough for them to afford health care insurance.
Right. So, so now along comes the Affordable Care Act, and we have a situation, I guess, where for a lot of these families, they have, they either can apply for health insurance through Medicaid if they're in a state that allows for that, or they can try to go to the exchange. Is this right?
That's correct. That's absolutely correct. But for a lot of families, in terms of affordability in those states where they have refused to expand Medicaid, these families have to make a difficult choice. You know, when you have to pick between providing health care for your family and for yourself versus putting food on the table, it's a difficult position for a lot of Americans to have to be in. And right now, because of the Obamacare, they can afford basic health care now as a result of being able to enroll in Medicaid.
Right.
And more of these states need to make that change.
Yeah, because I mean, basically, what we're looking at is that when states, refuse to expand Medicaid, they're giving these families what sounds like a very false choice. It sounds like
Exactly.
They're being told, you can have your health or this itty bitty bit of wealth, but you cannot have both.
Exactly. And when you think about $27,000 a year for some states, that cuts families off in terms of accessing Medicaid. So it isn't even a little bit of wealth. I mean, I have a family of 3 right now. I can't imagine living off of $27,000, especially in the district. In D.C., that's impossible.
Mm-hmm. Mm-hmm.
And when we're looking at the coverage gap that you mentioned, 4 million Americans are in that coverage gap right now.
Okay, yeah. So that coverage gap, that is that group of Americans where they aren't earning enough where they can shop for insurance on the federal exchange, but they are making quote unquote too much money to be in their state's current Medicaid program.
Right.
And how does that impact communities of color?
So within those 4 million Americans that are in that coverage gap, there's a disproportionate number that are people of color. 26% are African American and 24% are Latino. You're talking about 50%, 2 million people representing a small minority within the United States. They live in states like my home state of Louisiana or in Texas, where if you're a parent with 2 kids and you make $4,000 a year, $4,000, not $40,000, you won't be covered by Medicaid. And unfortunately, you don't earn enough to shop for insurance in the exchange.
Right. So, I mean, it's one of those situations where, families are, they're going to ignore their own health. I think we've seen parents who, have decided that, okay, like my child qualifies for Medicaid and I'll get them enrolled, but, I'm not going to, take care of my own health. Because I just can't afford it, and because I don't, qualify for a program. And this is where it's sad because that story is unfolding only in certain states. That isn't true, nationwide, right?
Exactly. When we look at those states that are refusing to expand Medicaid, it actually mirrors the health disparities that we see. And the states where we have expanded Medicaid, we're starting to see some improvements in terms of obesity rates, both in the pediatric population as well as the adult population.
Right. So you're actually taking us to where I want to go with, with talking about Medicaid is that, it's not just that, we want people to get insured. It's that, the big push for, things like Medicaid expansion is so that people can get enrolled and actually start accessing the care.
Right, exactly. That's the whole point. It isn't just to check a box that says we've expanded Medicaid, but it's to truly tackle health disparities in those communities of color that have been most adversely affected by chronic diseases.
Right. And you've been a Medicaid provider, for all of your career. And, I find it interesting that the program gets so much criticism when, there are providers like, you and me who have been at the front lines. And we know, what Medicaid is meaning to families that are in the program. And what I was wondering was whether you can kind of from your years of experience. I'm not trying to age you or anything like that, but but no, from your years of experience, I was just curious about what you have seen as in the terms of like transformations or just improvements that you've seen in children's health, families' health when the whole family is under that umbrella.
I've seen a huge impact when a mother is able to take care of herself and not have to worry about sacrificing being able to put food on the table to seek care, and not just in terms of sick care, but in terms of maintaining good health. When a young woman is able to go in to get her routine pap smear, making sure, with African American women, we're at the highest risk for cervical cancer. If that mom, especially in lower income communities, when she's the single breadwinner in a family and the sole provider in that family, if she takes ill, that impacts the entire family. It disallows her from reaching her full potential, and it certainly does the same for her children. When I take care of a little one, it's the parent as well that's partially my patient, because I know that the mother's health outcome directly affects that of her children. And I think states in general have done a decent job of providing coverage for children. I'm hoping that Congress is listening and make sure to continue with CHIP benefits. But in addition to that, the Medicaid expansion is key in maintaining family health.
Right. Because, the family that stays healthy together is the family that's going to pursue that American dream together.
Exactly.
So, so it's interesting that you have the experience of having grown up in, and lived in a couple of different states across this country. Like you were saying before, you've spent your childhood in Louisiana, and then you did, your education and training in California, and now you work here. Are there any, contrasts that really are glaring to you as far as your experiences both, on either end of that, of those medical encounters, either as like having received care and then also providing care, what are some of the things that you feel stick out the most to you when you look across the country and, from your own experiences?
Well, not only did I have the benefit of living in different states, I was also a Medicaid recipient growing up. I come from a single-parent home. My mom was a teenager when she got pregnant with me, so I experienced what the Medicaid system was in Louisiana, and there was a stark contrast between what Medicaid provided for in Louisiana versus California. In Louisiana, it was a Medicaid mill. You got 5 minutes with the provider. There were hundreds of patients being seen a day, and the waiting room was insane. And it actually changed my attitude towards the practice of medicine. I vowed early on, in knowing I wanted to be a doctor since I was 7, that I would never, as a pediatrician, work in a Medicaid mill, because I remember clearly as a child, it was just a horrible experience. And then when we moved to California, being able to see the difference, like my mom was actually able to pick a provider through the particular HMO that we had, as opposed to it being assigned in some random rural clinic. And the experience, I got to have the same experience as my friends who had private insurance in regards to how we interacted with the provider, the access to the provider. And I think that's reflective of how well California did in terms of financing Medicaid for underserved populations. When I moved out here to D.C., I saw something similar to what I witnessed in California, patients being able to choose their provider, having full access, an on-call system, all of these things. And I think it speaks to how equal healthcare can be for those who are impoverished compared to those who are financially more well-off, when states pay attention to providing access to care as a right and not a privilege. Right.
And so, I'm so glad that you're drawing these contrasts for us, because, this is, I think this is one of the things that, people who misunderstand and denigrate Medicaid don't really get at all, is that, this is not, some force of nature like the weather. This is, this is, policy. These are programs, these are agencies and services that we make for each other, that we are, either contributing to and strengthening, or we are, neglecting and taking for granted. And I think that, that story was just so powerful about how, different states with different visions can really actually create different realities, for families that are on the front line.
Right. Exactly right.
Well, Dr. Hancock, I want to thank you so much for coming on the program. We're excited to have you again. This is definitely not going to be your last time with us. We're going to have you as a regular because we love hearing from you and we love your insights. But thank you so much for joining us today, and hopefully, I'm hoping that Congress is paying attention to this State of the Union's health and showing it a little bit more consideration than they showed President Obama on Tuesday night.
Exactly. Well, thank you again for the opportunity, and keep up the strong work in advocacy. You're doing an amazing job.
Oh, thank you very much. All right, guys, when we come back, we're going to be talking more about the state of our union's health, and we're going to be talking about the one word that President Obama did not mention in his State of the Union address. We'll be right back after these messages. This is Dr. America, and I am your host, Dr. Sanjeev Sriram.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, and today we've been talking about the state of our union's health. So before the break, my guest, Dr. Yolanda Hancock, and I were talking about the importance of expanding Medicaid and what that means for the state of our union. I really thank her for her insights. I felt that she did a brilliant job of laying out in very human terms what Medicaid expansion means to millions of working families and families struggling out there. And this is an urgent issue. And I really encourage listeners, my audience, all of you guys to do something about Medicaid. I encourage all of you to keep up the pressure on your governors and your state legislatures. Even if your state has expanded Medicaid, it's worth demanding your governor, your state legislature, your state's health department to keep improving Medicaid so it can be an excellent source of care for millions of families. As Dr. Hancock pointed out, California and D.C. have done the hard work of enrolling families, helping those families stay enrolled, building those provider networks so that families can go to more and more doctors to get the care that they need and to see specialists when they need them. And all of that work is making the health care of Medicaid a high-quality experience for families where they're actually getting empowered to pursue their American dream and to live fuller lives. And, this is within our reach. This is definitely not something that, should be thought of as, well, we've done all that we can for Medicaid. No, there's always room for improvement, and we should always be striving for all of America to get the best health care that they can in programs like Medicaid. Now, if you live in a state where they have not expanded Medicaid, it's time to go turn up some heat on those governors and those state legislatures. And I actually think that we've got a really good vehicle for doing that. Last month, medical students and healthcare providers from over 70 universities across the country participated in White Coats for Black Lives to protest police brutality and the racial inequities present in the criminal justice system. In my opinion, we're going to need those same white coats to stand up for black lives, brown lives, poor lives, you name it, because they're being denied health care because we have governors in states and state legislatures that are playing these political games over the expansion of Medicaid And there are lives at stake. And a lot of those families and a lot of those lives, as Dr. Hancock and I pointed out in the last segment, a lot of those lives are from communities of color, disproportionately so. So I think if we're going to show this country that Black lives matter, that brown lives matter, that poor lives matter, then we're going to need to broaden that conversation about healthcare and make it a basic human right for everyone in our borders. The state of our union's health depends on this. So, moving on with this episode on the state of our union's health, let's talk about the one word that President Obama did not bring up in his State of the Union, and that was guns. You know, I know there's only so much a president can address in that yearly speech, and, but let's get real. I mean, the State of the Union's health is not going to improve if we don't talk about gun violence as a public health issue. And this year, 2015, we're learning that current projections are that for the first time, more young people are going to be dying from gun violence than from motor vehicle accidents. And on Tuesday, tragically on the same day that President Obama gave his State of the Union, earlier that morning, we were reminded about this ongoing threat of gun violence in the city of Boston. There was the death of Dr. Michael Davidson at Brigham and Women's Hospital in Boston. And for those of you who don't know what happened, Dr. Davidson had been caring for an elderly patient, and she unfortunately passed away. We don't know the details of her health care or of what happened exactly with her experience under Dr. Davidson. But what we know, the little bit that we know, is that her son had been very frustrated, had been quite angry about the care his mother had received, went to Brigham and Women's Hospital with a .22 caliber handgun, asked to see Dr. Davidson, and when he came to the exam room, there were two shots, and Dr. Davidson had been shot, and the shooter had killed himself after murdering Dr. Davidson. Despite the best efforts of his colleagues, Dr. Davidson, tragically passed away, and my thoughts and prayers are with that family, and and my heart goes out to to his colleagues, and it's just a really sad, tragic event. Now, I don't mean to draw attention to this doctor's murder just because he's a doctor, and I'm not going to get into this morbid exercise of whether Michael Davidson's death is more or less tragic than Michael Brown's death in Ferguson, because at the end of the day, from my perspective, both of these men are no longer with us because this country has a very troubling love affair with guns, and it's that cultural side of gun violence that we really, really need to work on, because Dr. Davidson's death is not a failure of gun safety policy. In the coming days, we're going to probably hear from a lot of the NRA lobbyists, if we haven't heard from them already, and some of the other gun nuts who drink their Kool-Aid, that they're going to point to Dr. Davidson's death, and they're going to say, see, Massachusetts laws don't make a difference. And, that is simply not true. Massachusetts has some of the safest and smartest gun safety laws in place. And this past summer, in this August 2014, Governor Deval Patrick signed another set of laws that actually do a lot for, keeping weapons out of the hands of troubled people. But there's still, work to be done in Massachusetts. I mean, some of the most basic laws are still missing there, and Massachusetts is ahead of the game. But yeah, some of the laws that are missing is that there is not a limit on the number of firearms that can be purchased at any one time, and there is no waiting period on a firearm purchase, even though the person buying the gun has to have a valid license. There's no waiting period. And, finally, they also, for unlicensed firearm sellers, they are not required to conduct a background check on the person buying the gun. But, that unlicensed firearm seller has to make sure that the firearm buyer has a license. So, Massachusetts has, it has a little bit of work cut out for it, and but that's not to say that the laws that Massachusetts already has in the books aren't working. I mean, they're actually, the proof is in the pudding. I mean, when you actually look at, the number of gun deaths in Massachusetts, they rank very, very low compared to, the rest of the country. And those smart gun safety laws have a lot to do with it. So, this is not about, Dr. Davidson's death is not because of a failure of gun policy. My position is that his death should really push us to reevaluate our gun culture. And the simple truth of the matter is that we have too many guns in this country and not nearly enough responsibility. There's only so much that, laws can do before we need to get real about, gun ownership. Walking around Target or a grocery store with an assault rifle across your back, that does not make you a brave patriot. I mean, let's get real. It makes you a coward and it makes you an idiot. I'm just going to say it just like it is. Talking about, gun rights, yeah, and I'm air quoting it. While you ignore rights to health care, housing, education, a living wage, that doesn't mean that you understand the Constitution or the Founding Fathers better than the rest of us. It's my position that it means that you're in denial about what's obsolete in 21st century America. And, with the tragic death of Dr. Davidson, we're already seeing that people are wanting to toughen up the way that hospitals, handle their security, kind of the way that we've seen, schools and, and stadiums and arenas and ballparks handle their security. And, I can tell you, I've been to Brigham and Women's Hospital in Boston, and like any hospital, there are lots of entry points because there have to be. Hospitals tend to be very open places, at least in the physical sense, if not if not in the other senses of the word open, but. There's only so much you can do to make each entry point safe. An armed guard and a metal detector and, at every door, that's not going to be feasible. But I'm sure that idea is going to get a lot of attention. And it makes me upset because, it looks like those kinds of things, like putting an armed guard and putting a metal detector at every single opening point of a hospital, it gives the appearance of taking action. But I just feel like it's complacency. We have so many schools across this country going through disaster drills where they simulate a school shooting. And it's just, what is that supposed to mean? Are we supposed to believe that, mass shootings and armed gunmen are now somehow inevitable? Every time I see stories about school kids going through terrifying simulations of mass shootings, it breaks my heart and it pisses me off because what it seems like we're telling them is that the gun extremists and the gun culture are right. It means that we are not going to confront the extremists' right to own weapons, and that and that their right to own a weapon somehow trumps our right to health. It somehow trumps our right to safe schools, to safe workplaces. I see these kids going through emergency drills at schools that are already pretty underfunded on their first and foremost mission of education. And, you see these kids and they're, cowering under these plastic covers that are supposed to protect them from bullets, apparently. And you watch all this, and, to me, it just feels as ridiculous as, watching those old black and white TV clips where, you see school children in the 50s and 60s, and they're all ducking under their, desks trying to escape nuclear annihilation. And it really just begs the question, at what point are we going to get real that weapons are not a fact of life? They are a choice. It is a choice that our culture makes, and we are overdue for reevaluating that choice. Gun ownership, it is a privilege. It is not a right. And it needs to be matched with a culture of responsibility. I believe in passing smarter gun safety laws, and I will advocate for that, but we really need to transform our culture around guns. And 2015 is as good a starting point as any other when it comes to guns and just using some common sense and looking at it as a public health issue that is really in ongoing urgent need of our attention, of our efforts, of our advocacy. So, I understand that President Obama had a lot to talk about in his State of the Union, but in my State of the Union's health, guns are still a major public health issue, and we're going to keep talking about it on this show, and we're going to keep pushing the culture to make the changes, the adaptations, the evolutions that they need to make. All right, so you've been listening to Dr. America. I am your host, Dr. Sanjeev Sriram. This has been our State of the Union's health. When we come back, we're going to be talking about how workplace policies are health policies. And we've got a guest, Dr. Marseilles White, who I'm excited to introduce you guys to. So all of that when we come back. Thank you for listening. This is Dr. America, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram. Thank you for joining us today. Today we've been talking about the state of our union's health. And we've covered a couple of different areas, but I'm wanting to kind of help folks sort of see the thread that I'm trying to weave for these health priorities. We started out the program talking about the importance of Medicaid expansion, and that we really need to broaden our notion of, how Black lives matter, how poor lives matter, how brown lives matter, by introducing that same kind of energy, that same kind of enthusiasm for advocacy that we've seen from white coats for Black lives. We need to see that same kind of passion for making healthcare a basic human right across this country. I think that drawing the connection between Black Lives Matter and police brutality and the protests against it, and drawing that to conversations about gun violence as a public health issue, that feels like it's a little bit of a easier connection to make. But I'm hoping that this episode is conveying to you guys, my audience, my allies, my colleagues, my compatriots, that when we're talking about health, that we need to broaden our notion of how lives matter outside of the clinical realm. That when we look at Medicaid expansion, when we look at gun violence, that we are seeing the web of mutuality that Dr. Martin Luther King Jr. referred to, and that it is impossible to continue as a country to preserve the state of our union's health and then build on it if we don't recognize that an injustice anywhere is an injustice everywhere. And whether that injustice is not expanding Medicaid, whether that injustice is turning a blind eye to gun violence, whether that injustice is ignoring our gun culture, we are not going to rise as a country in our health and our wellness and our, in our abilities to empower each other and to pursue our American dreams if we don't get real about just how broad our health really is. So I thank you guys for bearing with us through this episode. I hope you've had a chance to, learn a lot, and I'm excited about this last segment because there is actually going to be a lot of overlap in this next part about our State of the Union's health in this episode and what we're covering, and then also what President Obama covered on Tuesday night in his State of the Union, where he actually did, describe the importance of affordable childcare, paid sick leave, and raising the minimum wage. And he was making a very, very strong economic argument for each of these policies. But what I'm hoping to do in this next segment is that we can describe the positive impacts that all of these policies, affordable childcare, paid sick leave, and raising the minimum wage, that each of these policies actually has pretty important health impacts, and that we should see them just as much as health policies as we do as economic policies. And I'm looking forward to this next segment. When it comes to trying to connect these dots, I'm hoping that people are not misunderstanding my brevity on these issues as a disinterest in pursuing them more deeply. Actually, fans of the show know that we've covered paid sick days pretty in depth, and I'm looking forward to future episodes where we're going to talk about raising the minimum wage and actually, talking about living wages and the health implications. But this is a State of the Union. And it is, meant for, sharing a broad vision, describing where we're at, and most importantly, I think giving a vision of where we can be, where we ought to be, and that together as Americans looking out for each other, we can do better. We must do better. We are Americans, and we should start acting like it. I think that the stuff that we've talked about so far in this episode with Medicaid expansion, with gun violence, and now as we get into these issues of affordable childcare, raising the minimum wage, and paid sick days, I think that we're really touching on those parts of health that are not always within a doctor's reach, and that we really need you guys to get involved and help build this culture of health that really does depend on some of these things for which I can't write a prescription. Anyway, so our next segment, we're going to be talking with Dr. Marseilles White. Really excited to have her on the program, and when we come back, we'll be exploring more about the health implications of the president's agenda on affordable childcare, paid sick days, and raising the minimum wage. We look forward to having you back, and you've been listening to Dr. America, and I'm your host, Dr. Sanjeev Sriram. More in a bit.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right. Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, and today's episode we've been talking about the state of our union's health. I'm very excited about this last segment because we're going to actually be looking at some of what President Obama was talking about on Tuesday night, but from a health perspective. So, as you guys know, on Tuesday night, the president laid out some pretty important priorities for our economy, and especially for, the economy of families that are just struggling to get by. He talked about three important things that we're going to cover right now. He talked about affordable childcare, paid sick days, and raising the minimum wage. And, he made a very good economic case for each of these policies, but I think it's important for us as health justice advocates to actually kind of look at these policies from a health perspective and understand that there's a lot of positive impact that can come at both the individual and not just both, but at the individual, family, and community levels of health. So to help us, get through this conversation, I'm really excited for our next guest. It's Dr. Marseilles White. She is a board-certified pediatrician, and she earned her bachelor's from Xavier University in Louisiana and her MD from the George Washington University School of Medicine. She currently serves as the vice president for the D.C. chapter of the American Academy of Pediatrics. She sees patients in Southeast Washington, D.C., serving some of the city's most underserved communities. And every day, Dr. White is one of those people who witnesses firsthand the impact of current policies on the health and well-being of patients and families she cares for, and she ensures that her program, her approach to care, addresses the socioeconomic factors that affect health via the co-location of mental health services, oral health, and social work services to create a wraparound for the work that needs to be done to keep our families vibrant and healthy. Dr. White is dedicated to educating students and medical trainees about the social determinants of health and to inspire them to serve communities in need. And we're very excited to have you on the show. Welcome to the show, Dr. White.
Thank you very much, Dr. Sriram. I greatly appreciate you having me today.
All right. So Dr. White, as you probably heard on Tuesday night, President Obama was pretty quick to mention the importance of affordable childcare for families, and I think he was very eloquent and compelling in addressing how this helps the family budget. But can you help us understand how how high quality affordable childcare impacts children's health?
Absolutely. As a mother myself that has to attribute a significant amount of our family budget to child care for my own kid, I firsthand know the impact of child care on a family's budget. And then understanding that the families that I primarily serve have pretty restricted budgets to begin with. And certainly having to pay for child care, diverts funds in other ways where we talk as far as food security. If monies are spent significantly in one area, certainly that's diverting funds from other areas that greatly impact health. So in 31 states and D.C., child care is almost costs about more than the tuition at a public college. So
wow.
There's a significant economic impact regarding child care, and policies like the $3,000 child care tax credit that President Obama mentioned, that will significantly help families and help families to afford some of the other things that are needed to provide for their kids, such as food, such as adequate housing, quality housing, because if we can't sustain those basic needs and fulfill those basic needs that families have as far as food, housing, and safety, then we can't help them to actualize other issues. They can't manage their diabetes and their asthma if they're not receiving the basics. And having safe, quality, affordable child care for families has a significant health impact. Also, education is one of those significant social determinants of health. So having affordable, high-quality child care closes those achievement gaps that exist between kids living in more affluent neighborhoods and those in low-income neighborhoods. So being able to enroll kids in educational programs certainly helps to close that gap. And certainly we know and witness, and I see it firsthand, how education really plays into the health impact for the kids and families that we serve.
Right. And I mean, getting them that good start in school, I mean, that is a good start is a healthy start when it comes to school. And
absolutely.
And
kids in these programs, they get the opportunity to develop the social, the language skills that are needed to prepare them to go on to kindergarten and preschool. So it's very important, and the district has done a tremendous job as far as ensuring that kids receive early childhood education.
Right. So now we need to, make what's happening in our city happen across the country. And, I'm glad that you're bringing this up, because I think that there's a, big misunderstanding out there that, childcare is, it's like graham crackers and games of duck, duck, goose. But, it's a lot more than that.
Absolutely. And I think that's why it's important to use the language that we're using and President Obama used in the State of the Union address. And the fact that this is child care. This is not daycare. This is not just someone babysitting their child. There are actually evidence-based programs that are, based in curricula and theory that are promoting these skills, cognitive, social, language, gross motor, fine motor skills that are important in development. And we know that the child's brain, that early development, this is when all of those neurons and synapses and things are going on in the child's brain, and it's the key time to engage them in these type of programs and in this educational setting, because this is a time where things are sticking, and we're able to increase how much kids are grasping at this time. And it's important for everyone to understand that this is what we're promoting is child care. So we're helping to really lay the foundation for these early skills. It's not just putting kids in front of a program or babysitting. It's much more than that.
Right. It's about nurturing that nature.
Absolutely.
So, Dr. White, another policy that President Obama advocated in his State of the Union was paid sick days. And, we discussed this issue on Dr. America last month, and I'd like to take credit for the president's plans on, paid sick days. But, this is an issue whose time has come. And if you don't mind, just reminding our audience, how is our public health going to benefit if more workers are able to take the paid sick days that they need when they need them?
Sure. Well, I would like to give all credit to Dr. America's show for putting that seed in President Obama's plans, but I have to admit that the district has implemented since 2008 the Accrued Sick and Safe Leave Act, and I have been able to witness firsthand some of my staff being able to take advantage of that policy that was put in place in 2008. So the district was a little ahead of you, Dr. America. I don't think you can take full credit for it. But certainly, this is definitely a public health issue. It is not a blue issue. It's not a red issue. It is a public health issue, because if your child is sick and you do not have the ability, the advantage to take that day off from work to care for them, then they're sitting in the schools, they're on the metro systems, they're on the public transit with you and your kids that are well. So, us right now being in the middle of the flu season, there are 40 million Americans who would want to stay home if they got sick. but they're going to their workplaces because they can't afford to take that day off, and some of them might be at a risk of losing their job.
Right.
And the impact of that one day off for many of our families is significant. That one day that a family might take off to care for their sick kid, and if that day is unpaid, that might translate into not having enough food for the remainder of the month, not having enough money to put gas in the car to go to work. So the economic impact that has as far as families taking that time to care for their kids and not getting paid for those days, it is very significant. During the H1N1 epidemic a few years ago, the CDC reported that about 7 million cases were due to people showing up to work sick.
So they were getting it from their coworkers.
Absolutely. So, and that's what makes me say this is a public health issue. So that if you can't take that time off, then more than likely you're showing up at work, at school, infectious, and then spreading illness to others. So parents without sick pay days, they are twice as likely to send a sick kid to school than parents with paid sick days. Another thing that's really important, as we talked earlier about nurturing and early child development, parents are kids' best teachers. And so paid maternity leave is also immensely important. Mothers staying home, being able to nurture their kids, being able to breastfeed their kids per the recommendations that we provide them. They also need to know, these mothers, that they won't lose their job or their pay if they choose to take that time, to bond with their babies. And there, studies show, the data's out there, that mothers with paid maternity leave are more likely to have healthier pregnancies and healthier babies and fewer negative outcomes, like newborn deaths and also postpartum depression. So the data is there, and just like the district did as far as implementing the Accrued Sick and Safe Leave Act of 2008, we need the rest of the country to move forward with that.
Yeah, because this way we can, help our patients and families. They can walk the walk when we talk the talk about, don't go to work sick, and take time to, take care of yourself, take time to take care of your baby. This is the kind of stuff that makes our clinical advice real for for people.
Absolutely, I've had families say, mothers and fathers say, I can't do that. I can't take that day off. And some families don't have that social support where they can send them off to grandma or someone else, to take care of them. So many times, families have to make that decision. Do I send my kid to school sick, or do I risk losing my job or risk losing a day's pay and having to make decisions based on how economically that's going to impact the family.
Yeah, so we need to, really help these families from having to avoid, we just got to help them avoid those false choices.
Absolutely.
One of the moments in President Obama's speech that I really appreciated was his push to increase the minimum wage. And, I mean, this is a subject that I'm going to come back to on this show, and you're welcome to come back when I talk about this at length. And I don't mean to give minimum time to minimum wage, but his challenge to people opposing the policy was great. He said if you truly believe you could, work full time and support a family on less than $15,000 a year, go try it. Besides, just being good economics, raising the minimum wage is important for our health, right?
Absolutely. And I too agree with the president in giving people that challenge to say, go and try it. So if folks want to sign up for the minimum wage challenge voluntarily, I think they should. I think it would really give a perspective on how individuals really have to make certain determinations. As we stated earlier, those decisions maybe not based on the best evidence, but you have to do what you have to do based on, what you have available to you. And families that make minimum wage, they just have fewer resources to help them with the health problems. And, when we talk about health, as far as, my practice is concerned and how I look at health, health is just not me writing a prescription. Health is just not me listening to your heart and lungs. Health is ensuring that you have adequate housing.
Mm-hmm.
Health is ensuring that you have food on the table. Health is ensuring that you're safe. And if you do not have the money to buy the fruits and vegetables that we as providers are recommending that you have, your adequate serving, 5 serving the fruits and vegetables a day. If you do not have the funds to do that because you're making minimum wage, then that's just really unfortunate in this country. And it is harder to obtain the things that are really needed to keep you healthy. In addition to food, exercise, the medicines that we do recommend when we look at a health in a narrow focus. So things like high blood pressure, diabetes, I mean, those are things that are much difficult to control when all you have is that medicine, but you can't afford the other aspects that are needed to keep your blood pressure under control, meaning that you're not buying the least inexpensive packaged foods because those are cheaper and on sale because unfortunately you can't afford the fresh and healthy foods that are lower in sodium and those things. So, all that stress, also makes mental health a huge issue. When you're worrying constantly about, whether or not you have enough money to pay the rent, to keep your kids and your family in a safe environment, if whether or not you're worried about you have enough money to put food on the table at the end of the month. I mean, that toxic stress, that constant worry creates significant health problems. And the mental health piece is something that is just tremendous. And unfortunately, the resources to deal with those issues are very limited as far as mental health. So the burden as far as stress is huge, and if you're worrying day to day, it's just the way that the stress plays and impacts on the body is just significantly tremendous. So we all know that minimum wage won't fix all of the problems, but I certainly feel that it is part of the solution. Mm-hmm. It needs to be part of the continued national dialogue, and we have demonstrations. We have places that have done this. And proven that it works. And, the argument is that it's going to kill jobs as far as increasing the minimum wage. But in reality, not increasing the minimum wage is probably killing America.
That's right. That's right. Well, Dr. White, thank you so much for coming on the program and helping us see this web of mutuality that we are all bound in, and that economic policies are not just for the workplace; they're for for our health. And when we talk more about minimum wage on this program, we're going to definitely have you come back, because I think some of the socioeconomics and social determinants of health are things that our audience likes to hear about, needs to learn more about. And thank you so much for coming on the program.
Great, thank you. It's my pleasure. I look forward to coming back on.
All right. Okay, folks, thank you so much for tuning in today. This has been Dr. America's State of the Union's Health. I hope that you've been inspired. I hope that you're not feeling tired, because we've got a lot of work ahead of us to build a healthier nation, a more prosperous nation that really is working for all of us. That our perfect union is actually rising all of our ships and is helping all of us achieve our great American dreams. Thank you so much for tuning in. Really grateful for my guests, Dr. Yolanda Hancock and Dr. Marseilles White, for helping us connect these dots. I hope that we can do the work that needs to be done to expand Medicaid, reduce gun violence, and build better workplace and family economic policies that actually help wellness become a reality for all of our fellow Americans. You've been listening to Dr. America. I am your host, Dr. Sanjeev Sriram, and until next time, salud to your health.
listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
I'm a third grade teacher.
I'm a school bus driver.
I am a parent.
I am a teacher's aide, and I agree to be identified
as a caring adult who pledges to help bullied students.
I will listen carefully to all students who seek my help
and act on their behalf
to put an immediate stop to bullying.
I will work with other caring adults to create a safe
learning environment for all the students in my school.
In my school.
In my school.
In my school.
I'm Dennis Van Rokel, President of the National Education Association. Help us create safe, bully-free learning environments for all students. One caring adult can make all the difference. Be that adult and take the pledge at NEA.org/bullyfree. Adults have the power to stop bullying in our schools.
It starts with me.
It starts with me.
It starts with me.
It starts with me.
Bully-free. It starts with me.
Visit NEA.org/bullyfree. A message from the National Education Association.